SBIRT is about having a conversation with patients, people, about substance use. So SBIRT stands for Screening, Brief Intervention, and Referral to Treatment.
I screen people for their substance use, things like what they take, how often, how long they've used them, what kinds of problems they've ever seen with the substances. And based on those answers, I get a feel for if their substances are causing any sorts of problems in their life.
For us here at our site at Littleton, which is a Level 2 Trauma Center, we have 2 health educators that are educating people in the emergency department about their use of intoxicants. They also do go see patients that are admitted in-house or ones that we might have missed during the time that we weren't here. And they do motivational interviewing, so really just a natural conversation with patients about their use of intoxicants and educating them about how that really impacts their health. It's just a non-judgmental conversation.
I just kind of get going with a conversation and try to see if the people are experiencing problems with those substances.
The benefit is that we really do take the time and give the people that time and latitude to talk about their use of intoxicants. Typically we say things like, just stop drinking or stop doing those intoxicants because clearly you got hurt. Now we really take the time and educate people on those intoxicants, how they affect their health, what is really a limit for them, and then we go forward from there to see if they're motivated to get treatment if they are overusing or overdoing the use of those intoxicants.
A lot of patients don't realize either how much they're using or how it does affect their health unless you actually start to talk about it. And when you ask patients to quantify how much they're using, that in alone, I think they start to think, oh, well, let me think about that. So I think that that's a big benefit. Patients go home and they think more about it. They think about that conversation.
I will say that, I don't know, we're taking care of patients like we're giving like the best quality of service. We're improving, like we're cutting edge with this. Personally, I will say when I go to my doctor, they barely ask me take my vitals, and they don't care if I drink or I take drugs, you know? And that's affecting everyone's health. So offering SBIRT in every medical setting, I think is great.
Part of it, too, is education, not only for the patient, but for the medical staff, just understanding what is a healthy limit. For instance, at our site, one of the areas that we have some trouble with is a lot of, say, suburban moms or suburban people that are thinking, I just have a couple of glasses of wine every day with my girlfriends at lunch, and they're not really realizing that they're over drinking and how that really does impact them.
I thought, you know, who's really going to want to talk to me about this? This is private stuff. And not to mention, you know, who's going to really be honest about it? And I was completely taken aback by the response. I've seen a little more than 800 people now, and I can count on one hand 4 people, actually, who have asked me not to, well, basically who said that they didn't want to answer the questions and we didn't continue the interview, but 4 out of 800. So the response has been extraordinarily positive, and people by and large do talk, and they are, I really believe, honest about their answers.
From day one, you have to think about how you're going to sustain it, how you're going to build it in a meaningful way in the medical records, how you're going to QA it, how you're going to sustain it, and keep it going and let it pay for itself, and to really convince people that it does pay for itself. And I think the literature is out there clearly that doing the brief conversation does decrease risky behaviors, and patients decrease use. And in the end, you do save money and you save patients' lives.
For sustainability, I think that some of the keys are, again, the billing piece. I think that having the ability to be able to have those conversations, as I said, is essential, and we need to be able to have the time and latitude to be able to fund that so that it's not mandated without any kind of resourcing to it.
This is like a learning thing because we're getting better every time and trying to find some other ways to improve it. And we have struggles, but Finally, I think we are getting to the point that everyone is very concerned about getting this thing together and get every one of our patients screened.
I don't think there's anything that is more pervasive in our patients' lives and having an impact than substance use. Obesity is definitely a problem, and we should be talking to patients about that. And certainly seatbelt use and all the other things that we should talk about, blood pressure screening. But alcohol and substance use is just pervasive in our society, and it is having a profound impact on our patients in many ways.
We should probably be talking to people about if they have things, for instance, sleep apnea is a problem that's often misdiagnosed or undiagnosed. So we need to do more education in that area, as well as smoking, obesity. Those are all areas that we really need to be educating people more on relative to their health history. And SBIRT is one that is so prolific in our area that I think the use of intoxicant education is essential.
This is much more geared toward people who are using just a little bit over where they should be. So, for example, the woman who drinks 2 or 3 drinks a day instead of 1 drink a day.
We have had like a couple of great stories. Like they have told our health educators how they appreciate we asking those questions when no one else have asked them before. Like, it seems like we do care.
If you don't screen people, you won't pick up the fact that people are using at unhealthy or at-risk levels. And so I think it's a heightened awareness with the nurses, the medical staff, medical students, and patients. And of course, the best outcome is when you touch a patient and you make a difference in the patient's life and patients' families.
We really want to educate people on how it is affecting them. And we know that through trauma itself, there's a lot of recidivism in terms of injuries. And we see that this program really is evidence-based. We can look at the outcomes based on the information that we've already gathered on patients, and we see that it does have positive outcomes for them.
I just urge everybody, please, to just have that conversation with your family and with patients. Save a life.